Today I am reading from the book Spirit of Homeopathy, book written by Dr.Rajan Sankaran, Mind section, and chapter number 31, Heart of Case Taking, part 3. Eliminate the feature of pathology. The second point to look into is which symptoms are due to pathology, or in other words, which symptoms are common to all patients having that particular pathology. Since pathology is like a creeper that grows on the central disturbance, we have to cut off the symptom of pathology in order to get a clear picture of the central disturbance. I am not trying to say here that the central disturbance has no role in creeping or role in creating or sustaining a pathology. But I assert that it does have a very active role, but pathology itself often not characteristic of any particular central disturbance. At best, we may come to a group of remedy which are known to have a cure for this pathological condition. But since this frequently comes from the clinical experience and not from the proving, the list is far from the complete. It is always possible that the drug which is not known for the particular pathological condition could produce that pathology if it was proved in a susceptible person. So pathology is as much a part of the disease as the mental and general state is, but it is not its identifying feature. Arms and legs, the man, are very much part of him. In fact, they may be a most prominent part, but often they do not characterize the man as much as a crooked nose or a mole on the chin. In this way, pathology, being common to several central disturbances, loses its value as an identifying feature of the disease. The symptom that can be explained by pathology therefore become a common symptoms. The question we have to ask ourselves is, which are those symptoms in the patients which would have persisted even if they had totally different pathology? If you want to find out the identifying feature of the person, find out those features he would have even if he wore totally different clothes. The pathology on a central disturbance is like a cloth on a person. There can be no pathology without central disturbance, just as shirt cannot stand up without a person being there. Therefore, find out in a case of diabetes those symptoms which would have existed even if the patient had not come with a diabetes, but he come with another disease like any schizophrenia or etc. Find out those symptoms which would have a present even if he did not suffer from the same diseases, but from anxiety, neurosis or asthma. The mental symptom that do not depend on diabetes and which would have a persistent even if he did not have a diabetes are the symptom of that particular patient's mental state and considered as a central disturbance. The symptoms that are common to schizophrenia or diabetes, even though they may be mental symptoms, are mental disease symptoms and therefore do not represent the central disturbance. How to determine if a feature is situational or pathological or original? How to determine if the feature is situational, pathological or original? If there is a doubt whether the situation or pathology is responsible for the particular symptom, then we can use 3 criteria to help us determine the true state. Has the symptom existed prior to the situation or prior to the present pathology? If this is so, then it can be taken as a symptom of the central disturbance. For example, if a policeman we find in the symptom dictatorial, then the questions may arise whether he is dictatorial due to his occupation or he chose to be the job of the policeman because it was in tune with his dictatorial nature. The best way to determine this is to go back and find out about his nature before he became a policeman. If he was dictatorial even then, it can be taken as a part of his nature. To take another example, burning feet is common in diabetes, but if the patient symptom existed prior to the onset of the diabetes, then it assumes some significance. I often go back in the life of the patients and find out the picture as a child. It is in the childhood that the picture is totally clear and unadulterated and is not covered by layers of culture and pathology. The second way to find out the true original nature of the patient is to compare the intensity of the symptom with their intensity in other person in the same situation or environment or with a similar pathology. For example, ask if the policeman is as strict as the other policeman, or ask whether the aggravations from the motion is an intense in this case of joint pain. Is it more or less than usual? The third way to find out is to ask the patient which aspect if his situation is comfortable with, in which aspect he is comfortable with, and which aspect make him uncomfortable. It is likely that those aspects he is comfortable with are in tune with his nature and disposition. For example, a salesman whose job involves a lot of travel may say traveling is the best part of my job and account work is the worst. Another salesman may say, I have to travel, I have no choice. With accounts, I have no problem at all. One can easily see that the first one likes to travel and the second one is aversion to travel. Another questions we ask is, in which positions or situation would you be most comfortable? The situation in which the patient is most comfortable will be in tune with the nature. The best totality of the symptom would include mainly those symptoms from which one can get no clue about, means, and which do not depend upon, means, the patient's age, nationality, occupation, or pathology. As the totality gets more and more shown for the marks of the situational and pathology, the clear will be the indication for the remedy. Therefore, for the purpose of finding the remedy, choose mainly those symptoms from which you can get no idea whether they belong to a Russian grandfather who has cancer or an Australian child who has a cold.